Imagine you're on neurology rotation and a 45-year-old patient comes in with a staggering gait, nystagmus, and history of chronic alcohol use. The attending asks you what part of cerebellum is likely affected and why. Your mind races to vermis, knowing its role in balance and its vulnerability in alcoholic cerebellar degeneration. Welcome to our USMLE Step 1 High Yield Review on the cerebellum. This slide sets the stage for two key areas: the medial cerebellum controlling axial structures and the lateral cerebellum handling distal limbs. For step 1, the cerebellum is a goldmine. Think ataxia, clinical tests, and embryology ties. We will break it down with mnemonics and clinical correlations to help you ace those neuro questions. So let's dive into the medial cerebellum first. In this slide, let's focus on the medial cerebellum, specifically the vermis, shown in red on this sagittal view. The vermis controls axial and proximal limb musculature like the trunk, shoulder, and hips. With bilateral influence via the fastigial nucleus, it integrates vestibular input to keep you balanced and upright. For step 1, the lesions here, often from alcoholic cerebellar degeneration or medulloblastoma, causes truncal ataxia, wide-based gait, and nystagmus. Our mnemonic, vermis moves middle, helps you remember. Vermis controls the middle or axial muscles. A classical question here would be, a patient with nystagmus and unsteady gait has a lesion where? The answer would be vermis. Test this with the gait and stance like the Romberg sign. This slide is key for midline deficits, so let's move to the lateral cerebellum and how to test its functions next. Here's the lateral cerebellum, the hemispheres controlling distal limb musculature, like hands and feet, ipsilaterally via the dentate nucleus to the motor cortex. This slide highlights their role in precise movements. For step 1, you will test these functions with rapid alternating movements like pronation and supination, finger to nose, and heel to shin, looking for dysmetria, intention tremor, or ataxia. Patient often falls to the lesion side during gait testing. Our mnemonic is hemispheres handles hand. Ties hemisphere to distal limb control. A classical question would be, a patient with intention tremor during finger to nose testing has a lesion where? The answer is cerebellar hemisphere, often from stroke or metastatic tumors. This slide nails those ipsilateral limb deficits, so practice these tests. If this helped you for your step 1, please like and subscribe for more high yield reviews.